Good morning, guys. Chuck Spicer here, celebrating another town hall. We've had some location challenges today. We started outside with wind and noise from the traffic. We moved inside. Travis, our fearless AV leader, has guided us through this process. April is our boom manager at this point. So we're excited to be here again. This is a week out of, I guess, a little bit more than that, guys, of the announcement of the integration and merger to create OU Health, to create a we. And so we're here today to talk a little bit more about that, to be able to answer some questions that have already come through our comments, but also just to celebrate the continued work and efforts to become a true combined effort. So Jason, John, we are here from the basement of OU Physicians Building. You'll hear sounds of patient care around us, which is what we're supposed to be doing. So it's good to be here, guys.
Thank you, Chuck. Good morning, everyone. As Chuck said, we're definitely following through on moving around the campus. We were going to have a trivia question to see if you could guess where we were, but no worries.
Well, they don't know where we are in the building.
That's true. If you can figure out where we are in the OU Physicians Building, please send that to becomingwe@ouhealth.com.
Gosh, dang it.
So thank you very much for joining us today. Also want to highlight for Chuck and John, huge appreciation from our entire community for the COVID remembrance event last Thursday. I know that was very powerful, and hopefully everyone had a chance to look at that. As Chuck said, we're following up on our communications very recently about the integration of OU Health, becoming we. And we're joined today by Dr. John Zubialdi to talk more about that. Please keep sending your questions to becomingwe@ouhealth.com. We've been listening very closely. We'll have some updates today. We know we need to get to other updates in the weeks to come, and appreciate your time.
Great. So Chuck, Jason, thank you so much. It's great to be with you today. I think I just want to try and focus in a little bit this morning on several points that I'm sure many of you have as you're really thinking about the becoming we and really what does that mean and what does that mean to me. I would just start out by saying I think we all recognize that any change oftentimes really just creates a significant amount of uncertainty. So one of the major goals that we're going to have for these kinds of forums going forward is really trying to get to the meat of a number of questions that you all have and some points around that to really try and create a better understanding. A lot of this is really going to be a bit of a process as we get to what are called definitive agreements between the university and OU Medicine in truly creating OU Health, the becoming we that we've talked about. Those defining agreements are going to be the things that will allow us to get the specificity that I know everybody is really hungry for. So as that process moves forward and we have those agreements in place, we'll be able to get at that additional detail. As you've heard, OU Health is truly the merger of OU Physicians and OU Medicine coming together as we in one entity. This is a truly integrated academic health system that is being formed out of us coming together, and it's a milestone for us in that we're really not only going to be able to focus on a more siloed approach to clinics and clinical care or hospital and hospital care, but bringing all of these together into one so that we can have all of the advantages, not just the efficiencies, but especially from a patient care standpoint, so that it's a seamless, as you've heard Chuck and Jason talk about many times, we really want this to be a seamless process for our patients so that everything we do really comes together well. It also means that we're going to be having some transitions in employment, and I know that that is one component that many of you all who are probably watching this morning have the most interest in, because it's the fundamental question, what happens to me? So we're really working diligently on those kinds of questions to be able to give you the specific answers that you need around that as well. And we're going to have additional town halls on the specifics around those job transitions as well. And I think I want to make just a few points this morning that will help in that regard. So first off, if any of you are transitioning to the new OU Health from the University of Oklahoma, we want you to know that your years of service will be recognized as it applies to your eligibility for benefits. We're also working on exactly what this transition will look like in terms of paid time off, and share those details with you as soon as possible. I know those are being dealt with right now. There'll be obviously a registration and onboarding process for all employees that may be transitioning, because we want this to be, again, seamless. We want people to be fully aware of, how this is, what this new working arrangement is going to be like. And then obviously planning meetings specific to this, and where our OU Health HR team is going to be able to give you more information, more detail that will be necessary to you. So, Chuck?
Thanks, John. It's, again, a lot of work being done. I think some major steps that have been taken are the organization around the transition team and breaking out the departments and areas that will work together. We announced last week that Dan Harrison from ECG will take the role of Chief Transition Officer, reporting directly to the steering committee, which is a combined group of our boards. Dan will also work directly with John and I to keep us updated and involved. John and I are involved in multiple committees to make sure we keep moving this forward. A lot of work to be done, but Dan's job is to keep us moving toward that July 1 goal of the transition and make sure any barriers that remain, we're able to deal with and address and move forward accordingly. So Dan will be on site, I think, a little bit more with the ability of having vaccines available and more socially distant or accepted practices now with hopefully a break in the pandemic. It's important for Dan to be here. Dan has been a reliable source of guidance and information over the last several months. We look forward to Dan being here. We also have combined our leadership teams. Rather than having the separate leadership team within John and OU physicians in the College of Medicine and the hospitals, having them meet separately, we work so much together, it didn't make any sense to keep that apart any longer. So we've traded our team ones for one team. And John and I will work with our combined team, our combined effort, to keep that as an ongoing source of information, to cascade it down, to be able to inform the groups across the campus of what's going on, but also to make sure we can move forward on strategies accordingly. We are not moving backward or staying still on everything else that's going on. We continue to move forward on quality, patient safety, patient experience, and all the things that make us the academic health system that's premier in our region. So this will allow us to not stop, not slow down, but to move forward together in a combined effort.
John?
Yeah, great. Thanks, Chuck, for that introduction on on truly the major transitions that we're having with bringing our executive groups together. As Chuck mentioned, Dan Harrison of ECG is serving in the role of was our chief transition executive. And I'll just also say that if you have specific questions that you might want to ask Dan about, you're certainly welcome to email the becomingwe@ouhealth.com and put his name, Dan Harrison, in the subject line.
Thanks, John. I screwed that up and didn't say that.
All right, talk about staying on script here.
Yeah.
That's right. So at any rate, just wanted to basically say, let me give you a little bit of the details around these, the transition teams that Dan's leading, so that you know who's on these teams and who's involved. So the teams are now officially called the following. First is the OU Health Human Resources team, which will be dealing with the human resources questions, the OU Health Finance team, and the OU Health IT team. As you can see, all of these are really key areas to the proper transitioning and proper functioning of any integrated organization. The Human Resources Transition Team is being led by the following key individuals: Jed Liuzza, Diana Maddox, who many of you know from OU Physicians, and also Lisa Thompson from the OU College of Medicine Dean's Office, related to our physician faculty. Jed and Diana, again, are going to be focused predominantly on team transition. And obviously Lisa, as I said, is going to be really focusing on being the primary contact for our physician faculty. OU Health Finance team is going to be led by Ann Barnes from College of Medicine, as well as Jim Watson throughout this transition. And the OU Health IT office, another really key team, is being co-led by Maria Russo and also by David Horton on the university side. The transition offices will report again, as we said, to Dan Harrison as the transition leader. And we just wanted you to be aware of these teams and who's on these, so that should you have specific questions around those, you can also direct those questions to those leaders. Thanks.
Thank you very much, John. Thank you, Chuck. Again, hopefully you've had a chance to hear today, as well as in our prior communications, about our Chief Transition Officer, and as John and Chuck have said, specific individuals who will be at the forefront in finance, IT, and HR in the OU Health transition. Very exciting. Chuck and John, your leadership teams meeting together. It's just a couple weeks since we did our internal announcements and our external announcements about this next step for integration. We've gotten in our questions, the Becoming We, thank you for sending those. We've gotten questions about governance, so I was going to follow up on that a little bit. So as you may recall, and we showed a slide on this last time, and you can see it on the Becoming We website, you can talk about how we're operating today and our vision for the future. So governance, for all of us here, we're a large enterprise, a complex enterprise, and governance has a defined role, just as our leadership has a defined role, and most importantly, how each of you on the front lines really provide the care, do the research, train our learners. And we created in 2018, as you know, the OU Medicine Inc. board, which was a major milestone, moving away from a joint venture that was previously with HCA, an out-of-state for-profit company. We formed a local nonprofit board. And I think you've become familiar over time with that board's oversight of transitioning from HCA, building the new company here in Oklahoma, and then increasing affiliation and integration with OU physicians in the Health Science Center. We also have today the OU Board of Regents, which I think, as you know, has governance and oversight for OU physicians here in Oklahoma City, OU physicians in Tulsa, and the Health Science Center. The Hospital Authority and Trust Board, which I believe you also know well, really made a commitment in 2018, along with the university, in forming the OU Medicine Board. The trust had been the sole member in the HCA joint venture with HCA and a governing committee from 1998 until 2018. The trust board, as you know, also has additional roles in support, not only for our hospitals, and particularly the Children's Hospital, not only providing care to uninsured patients and underinsured patients, but also supporting training and research programs. So as you know, the funding that we were able to sustain for graduate medical education was through the Trust, Hospital Authority and Trust Board, as well as the current research renovations in the Biomedical Science Building. So you've heard of those boards, and then most recently, hopefully you're familiar as well with the OU Physicians Council. In 2017, OU Physicians in Oklahoma City moved from a federated to a group practice model. And so those are the four boards that you heard about in our prior town halls: the OU Medicine Board, the Hospital Authority and Trust Board, the Board of Regents, and the OU Physicians Council. We are happy to answer more questions about that, but wanted to start on where we are today and where we're going in the future. And one of our major goals is, as we're unifying how we all work together on the front lines, as we unify our leadership teams, that we unify our governance, and just the experience we've had over the past 3 years in leading and growing this complex system, to think about ways that our governance can be more efficient and effective. So what you've heard in our previous communications is the OU Health Board. So this is the board where we're going to try to put as much oversight as possible for our care delivery system for OU Health. Right now, for major projects, we oftentimes need approval from more than one board, and particularly the OU Medicine Board and the Board of Regents. And the Hospital Authority and Trust and the university, as you've heard, committed with the integration and merger work. The project started last April with ECG to really put all of the efforts for care delivery and resources, competencies, talent into that OU Health Board to oversee this unified system. So that is the headline for the commitment of the Trust and Board of Regents. And the OU Physicians Council, as you know, now has several years of working together as a group practice. And the OU Physicians Council has committed to being part of OU Health through the OU Physicians Inc. Board, which I think you saw in our previous slides. And it's even broader now with OU Health Partners, thinking about our physician providers and our other advanced practice providers. And the OU Partners Health Inc. Board, which may be a new term for our listeners, which you'll hear more about, is really committed to work in partnership with OU Health to really grow the provider practice across the system. And as it works with that OU Health System Board, and the OU Health System Board delegates responsibilities to the OU Health Partners Board to really improve our efficiency and effectiveness. As you know, our boards, we have experience now just over the past several years, the time we put into it, the agenda items, things that we have addressed, things that we want to get to. And overall, we feel that this governance model, most importantly, supports the unified leadership, just as unified leadership will be supporting our frontline caregivers. So hopefully that helps a little bit in the governance. I know it's somewhat of an abstract topic. Again, the last thing I'll say is the role of governance is for the academic health system to be successful, to listen to the organization, the system, to provide oversight, but to enable every one of our 12,000 strong team to be successful. I think it's back to John, actually.
Yeah. So, thanks, Jason, for that great overview. I think what I'd like to touch on right now is really around again, get back to some of the more specifics around the positions and potential transitions in positions. We've had a number of people who've emailed us at becomingwe at ouhealth.com asking about this. So let me kind of give you a bit of an outline on that. Obviously, we're already a large enterprises coming together to create a more unified and entity that can work together to serve our patients' needs. A great enterprise basically needs great people, and you are the great people who are working with us in all of these aspects. So as we are focusing on that becoming we, there's obviously going to continue to be major need and huge need for important roles: nursing, patient service representatives, billing office, medical technicians. You can just kind of go down the line. There's obviously a lot of really important folks, and many of those are you who are on this call this morning. You've also likely heard that we have a large number of roles within our organization that need filling, that need to be filled. So what we're doing in regards to that, so that we can make sure that this is a coordinated process, a well thought out, well coordinated process, is we've put in a hiring review process whereby our leaders who are looking at the needs of the organization can really focus on what those needs are and make sure that as we move forward, that hiring process is done in a coordinated fashion to make sure that we have the best talent for the positions that we have. Because again, you all and our human resource talent, our people, are our major important asset. So just wanted everyone to understand that this hiring review process is in place, okay? So that, and our leaders are doing that in an expedited fashion, because we know that many areas have significant need right now, and we need to not have a process that's slow or cumbersome in order to get these filled. In addition, as we become we want to make sure that people understand that this process of coming together, of making sure that positions are filled, that this is done in an equitable fashion so that we have the best people and the best talent in the right positions. And again, as you've heard from Chuck say in earlier presentations, you know, there are a lot of roles within this organization that we will need to have talented people filling in the future. So again, I think there's obviously a lot of concern about, is there going to be a place for me? We just want to make sure that you understand there's a fair and equitable process for determining, you know, how these positions are going to come together, and then again, how we make sure that we have all of the roles that we need for a great organization filled going forward. And I don't know, Chuck, if you wanted to say anything.
Yeah, just to kind of close it out and hand it over to Jason. It is an exciting time, and there's a lot of moving parts, and I think we know that we're trying to be as transparent with the information we can be. Some of these things come around on a fluid basis, so be patient with us. We're committed to the transparency. But as I reflect on becoming we, I reflect on a couple of events recently. We talked about the COVID remembrance on Thursday night last week, and what a moving moment that was for us as a combined effort of a team. It really was a we. Not only was it a we as a healthcare team, but it was a we with a community. And I think that was really cool to have that experience, albeit in a very cold environment. It was special to be a part of, and it's hard to believe it's been a year, and it's been a year that's reinforced the need for us to be that combined effort and that we. The second thing, and I have my weekly message this week around the vaccine clinic, and I had a real honor to be a part of the vaccine clinic volunteers on Saturday. Saw both at the Children's Atrium and Embassy, the people that worked together seamlessly in a very efficient way, no boundaries, no silos, just a singular focus on delivering a vaccine of hope to people. And then I saw the people that came in from every corner of our community, every demographic, every age group, every ethnicity. And it was really moving to me because for the first time I focused on a word in our mission statement that I had really kind of overlooked. I've talked about combined and striving and the people that we serve, but I really focused on the word all and all people. And I saw all people being served that day with a smile on their face and with hope in their eyes. And it was a really emotional time. I think that we can celebrate a we. So Jason, I'll let you conclude.
Thank you, Chuck. And as Chuck has said, this is a process. We are becoming we. As you listen to this today or you play it later, we're not waiting. July 1st is our next milestone, and that's where a lot of focus is. But there's events, as Chuck has highlighted, John have highlighted, where we're becoming we today, and you've become we. We've had a lot of milestones over the past several years. We're excited the way we're going. The reason that we're focusing so much on July 1st and this four-stage integration process and the recent communications is structural changes that we feel will enable you to become we. On the other hand, we don't believe that just because we change a structure that automatically cascades the organization. We're thinking about how we empower you. We know you're motivated, as Chuck said, for the vaccine clinics, to providing care right now, your passion for distinguishing our clinical care by research. Our learners right now are improving access. You chose to become part of OU Health, to become part of OU Medicine, OU Physicians, the Health Science Center. You chose to be on this team, and we know that you want to bring other people onto this team. So much of what we're doing by July 1st is making structural changes so that you can be empowered. If I think about how to talk about governance, governance shouldn't be about control. Governance should be about empowerment, how we support our hugely talented team. Thank you for your time. I think exciting announcements this week on some specifics about who's going to be at the forefront of the transition. Huge appreciation to John and Chuck. I know that their teams are excited to be meeting together. And again, it's that cascade through the organization as their teams meet together that enables other teams to meet together. Please keep sending questions. We know that we have many questions that we did not answer today. We will answer. You're going to see an increased cadence of these town halls of going through the specifics. We know how important these decisions are to you individually, and we're committed to getting you that information. Thank you for the time today, and I guess it'll be a surprise location for the next town hall.
Yeah.